Happy lunchtime, everybody. Thanks for joining the Wednesday webinar for Population Health. This is Meredreth Maynard. I'm the Director of Quality here at UPC. I know I've met many of you, but there might be a few that I haven't had the opportunity to meet yet. So welcome to today's webinar. Berta asked if I would share with you guys just a really high level of Plan, Do, Study, Act for the PDSA cycles. I know many of you have received lots of training over this process, but we thought maybe a high-level explanation might be helpful for those who are maybe new or maybe new to just having to put this down on paper. And what does that look like? So what is PDSA and how do I do it? So that's probably a big question when you see those requirements that, oh, we're going to work on a new process, let's PDSA it, we're going to see what works best. Well, what does that really mean? So I think to understand what that means, you have to back up a little bit. And so you have to look at what the model of improvement is. So this is kind of background planning on how we begin to emerge into the PDSA cycle. So there's a few questions that we ask. And if you have a PDSA worksheet that's available to each of you guys, you'll see these questions kind of outlined. So the first question is, what are we trying to accomplish? So that's kind of your goal. So I thought for today we would look at a specific goal. I understand you guys have picked breast cancer screenings for this month to really focus on. So maybe our goal is we want to get our breast cancer screening rate greater than 75%. So then the next question we're going to ask, well, how will we know that a change is an improvement? So how do we know that we were successful in meeting our goal? Well, of course, we're going to measure that. You know, we love data around here, and we love to measure things. So we can use maybe the data baseline results, a possible EPIC report, scorecards. We need to know how are we doing before we start this change. And then also, did we improve? And then the third question, when we're looking at a model of improvement, is what changes can we make that will result in improvement? And this is where all of our ideas come in. So this is your staff meeting when you're sitting together and you say, well, we have to hit 75% for breast cancer screening. What do we do? Well, that's when everyone starts throwing in their ideas. Well, maybe we try sending letters, or maybe we do a contest in our clinic, or we'll have all kinds of ideas. And then we have to figure out, okay, well, which idea should we start with first? And that's what you're going to test. And that idea is what you're going to put the PDSA cycle on. So PDSA is a process of just testing a change or an idea. So you can see there's lots of ideas here. Maybe it's a postcard, phone call, pre-visit planning process, huddles, workflow reminders, all kinds of ideas. We're just going to pick one of those and put a PDSA on it. So I decided to pick an example. In my primary care doctor's office, they use a small pink heart. So when the patient comes in, the MA asks if they're eligible for a mammogram. She checks that, and then she asks them if they're interested, and if so, then she puts the little pink heart on the monitor screen, and then that indicates to the provider to discuss it or to order it. So let's pick that as our idea for this PDSA cycle. So we're just going to pick one of those ideas and put it to the test. So the first thing we're going to do is we're going to plan. And I know a lot of you guys spent some time maybe last week or in the last few weeks planning. So state what the idea is, and then also predict what you think will happen. So these follow the questions on your PDSA worksheet. So one, we're going to state what our idea is. So for this example, we're going to put the pink hearts in the room, increasing our mammogram orders for eligible patients. And then what do we predict will happen? Well, we predict staff will order mammograms for 90% of the eligible women. And then we hope that at least 75% of those are able to get their mammograms. Then number two, develop a plan to test the change. So this is the who, what, when, where. So we want to start small because this is just an idea. And so for this example, let's pick Dr. Smith's pod, and we'll say Mary, the MA, is going to ask the patient, and she'll be putting up the pink hearts on the computer prior to the doctor entering the room. So that's our plan to test the change. And then lastly on planning, we're going to identify what data we will need to collect. So we can't, going back to that measure, we have to know ahead of time, how am I going to know if this idea is working or not? So we identify what data we will need to collect. So we're going to collect patients eligible for mammograms and then the number of mammograms ordered. So that will conclude the plan phase, and we're going to look at the do phase. So this is when we're actually going to run the test on a small scale. We're going to carry out the test, which is number 1. So we say Mary's going to do the heart process for 1 week. Then we're going to document the problems and unexpected observations. So at the end of the week, sit down with your team and say, okay, what worked, what didn't work, where should we go from here? Well, so maybe in this example, the hearts don't stick to the computer screen, or maybe Mary forgot that she had lots of patients coming in for nurse visits and we didn't screen those. Maybe we ran out of hearts. So these would be all problems or unexpected observations that might have happened when we tested this idea. And then we're going to collect and begin to analyze the data. So in this first week, we had 20 women come through that were eligible for a mammogram, and 4 of them were scheduled. So that concludes the do. So it's just a short, quick test of the idea. The next piece is the study piece. So this is where we're going to analyze the results and compare to our predictions. So as a team, look at your data. In this example, only 20% of Dr. Smith's eligible patients were actually scheduled for mammograms. Well, if you remember, in the plan phase, we predicted that we were going to schedule 90%. So 20%, far less than 90% predicted. And then finally, we're going to summarize and reflect on what we learned. Well, Mary came back to the table and she said, this is a great idea, but I need more support. I can't do this by myself. I need someone to help me. I need maybe help identifying the patients. Maybe she needs more durable supplies with a better adhesive, obviously, if they're not sticking to the computer. Maybe she just needed more of those hearts. So it's really looking at the observation and what did we learn from that? Maybe what can we do differently as we begin to continue to test this idea. So that's very simply the study phase. And then lastly is the act. So based on your first test, you make a plan for your next step. So this can be kind of the difficult piece, especially if you've put a lot of time and energy into this idea, or maybe you really love this idea. But we really need to be objective and say, okay, did this work? Can we make it work better? Do we maybe need to move on to something else? So there's 3 options in your act phase. One's to adapt. So we're going to make modifications and run another test. So in this example, maybe it was the things that we discussed in the study phase. Maybe we need to adjust the heart. Maybe we need to make it more stickier. Maybe we need to identify more patients ahead of time. How do we incorporate the nurse visits and not just the regular visits? So we can take this one idea and make a few tweaks and run it again. And then after you make those tweaks, you're going to go back and do the same process. You're going to start over with your planning, and you're going to predict what's going to happen. You're going to do the do phase, the study phase, and then you'll come back. And there might be multiple adaptations to improve that idea. Your second option is to adopt. Say we came back, maybe our results were a lot better. Maybe we scheduled 19 out of 20. We didn't observe any major issues. Everyone seemed satisfied with the process. We were getting the results that we needed. So then we would test it on a larger scale. So then maybe we move from just doing it in Dr. Smith's pod to Dr. Smith and Dr. Jones' pod. We make it out to a larger scale. And then we follow the same PDSA cycle again to see how does it work in the next pod. Make sure it's still going to work well, because we know sometimes things work really well in one location, but they may not work as well in another location. So let's test it and see if this is something that we can kind of spread through the organization. Our third option would be to abandon, and this is probably one of those painful choices when you put a lot of energy, or maybe it was your idea, but we have to be objective and come back and say, okay, you know what, we really didn't get the results that we wanted. Maybe sending letters out isn't the best idea. We didn't get the results. We're not getting the results even after we adapted it. So sometimes it's best to let things go and either maybe revisit them at a later time, but recognize that we're not getting the outcomes that we need. And that's the beauty of this process, is so that we can see those outcomes. We're not just blindly applying ideas and initiatives and not seeing any results. So that wraps up the ACT piece. So as you can see, your journey to achievement is going to consist of many tested chains until you finally reach your goal. So if you start at 30%, it's rare we're going to be at 90% the next day. So we might start with one idea, and we do a PDSA, such as these physical workflow reminders, and then we tweak it a little bit and make it a little bit better, and then we say, okay, well, now we're at 60%, so what's the next level? What's the next layer of things that we need to do? Okay, well, maybe we're going to do some campaigns, and we test those, and we try that. And so slowly it's just this series of different PDSA cycles till we get to where we want to be in the end. It's important to just not get overwhelmed by the process. Just make it part of what you do. And that makes it a lot easier than being intimidated by having to spell out lots of lengthy processes on paper. It almost just becomes part of your culture, and you can simplify it very much down. Your PDSA steps don't have to be extensive. They can be one-liners. It just keeps you focused, and so that we're doing and applying things that really make sense and provide value and get us results that we need. And then hopefully at the end you'll find success, and there'll be a process that we can share throughout the organization. And we talk about spread of ideas and implementation, and that kind of comes after our model for improvement, and after our testing phases in PDSA, that we can say, hey, this process is proven for us and it worked. Here's what you should try. Or maybe we say as a system, this is going to be our process that we adopt across the organization. So if you're looking for that PDSA worksheet, you can go into your CPC Plus Connect website, and under there you'll see a folder for PDSA resources, but I believe if you scroll down just a little bit more, you'll see the template for the PDSA worksheet. It's a one-pager, I think, front and back. It has those exact questions that we just stepped through. So as you're working on these, feel free to let us know if you have questions, if you need some help getting started. We would be happy to help with that. I know Verda has some expert process folks that can sit down with you as well. And anyone from my team is happy to help as well. And maybe you need to get some different resources for each layer of that PDSA cycle. So I appreciate your time today. I hope this helped break down the process a little bit more, and hope you have a great afternoon. Thank you.